podcast number 5, Social and Community Context. In Iowa, the Ethnic Minorities of Burma Advocacy and Resource Center, or MBARC, leaders are working to address these disparities through peer education and mentoring programs to reduce isolation and preserve culture. We'll be hearing about MBARC's programs from the organization's director and some of the peer education staff, summarizing how MBARC is working to help refugees from Burma understand and adjust to their new homes in Iowa.
MBARC was started by myself and 6 refugee leaders from Burma. Back in 2011, we started meeting simply because what we were seeing in the community is a lack of resources. We're talking about not enough food, proper clothing, shelter, the basic things. The refugees from Burma started arriving in Iowa in about 2009 and has been the largest group of refugees to come to Iowa every year since 2009. About 8,000 refugees from Burma are currently in Iowa statewide. And at that time, we were seeing that there was a huge gap between refugees who arrived here and their pathways to self-sufficiency. So we started with those who were doing the work and with the belief that the community members themselves have the power and the knowledge and the motivation to make change within their community. And we're taking the information and the knowledge to the community through what we call learning circles. So we go into homes, we go to churches, we provide childcare, and we teach at a level in which the community members are teaching in their language with the cultural understanding, so that we really want community members to understand and actually be able to apply that knowledge. So we provide the education, we provide the social services, and it's done within the community from Burma. They're part of the planning, they're part of the implementation and the evaluation. So that's through Parent Navigator. We have that as well, which is a train-the-trainer for parenting and child development. We also have that for Youth Navigator, which is related to secondary, post-secondary education and work readiness. And we also have a new program called Refugee Rise AmeriCorps, which is based on the same principle that you invest in the community members, you give them the training and the support that they need so they can grow their own leadership skills and help their own community. It's hard for someone who grows up in America to try to put themselves in their shoes, but if you imagine living in a refugee camp for 10, 15 years, you haven't used electricity, you haven't had to lock your door, you have no bills, you don't, and then you come to the United States and everything it's almost like coming to another planet. How to use a stove, and so we'll see even basic things like grocery shopping, using the bus. Those are really, really intimidating. And it's not just the language, but it's also the culture. You know, we have the American system of services is extremely difficult and very, very intensive when it comes to the bureaucratic nature of getting services. So for someone who doesn't speak English, who is unfamiliar with anything with the Western world, and has suffered through a lot of trauma, and they're coming here and they're having to get a job and take care of their family, it's a tremendous, tremendous barrier. But what's important to realize is that it's also a community that has a well of strength and resilience. Families come here because they want, if the number one thing is, I want my children to have a better life, right? So they are so eager for the opportunity to rebuild their life, to have a country. But when they're here, services are really limited. You're talking about 90 days of resettlement services and then perhaps some follow-up services afterwards. I think mental health as a term is not understood by the community because everyone who is a refugee suffers that trauma. The suicide rate here, 1 year there were 9 attempted suicides out of a population of 8,000. The level of isolation, a lot of community members will say, I manifest it physically. My stomach hurts, my back hurts, but given what they've been through, I think there's a stoicism that's there. I think what has worked is offering a space where community members can get together and to celebrate their identity and just feel good about themselves, right? So we were seeing that a lot of women, older women who used to live in villages, much more communal areas, they were very isolated. They weren't working and they were at home. And one of the things that they took great pride in, and it's such a skill, is their backstrap weaving. And they would spend days. And so we actually had a volunteer create some looms, and we purchased the thread, and they meet regularly to do some backstrap weaving. We connected them with the Weavers Guild in Waterloo, and they kind of teach each other. So it's a cross-cultural exchange. It's also an intergenerational exchange, because the younger women have the daughters and the granddaughters has lost touch with their culture and their identity, and they don't. And seeing that the value of their mothers and grandmothers bring this, so they're trying to share their heritage through doing that. So they've been able to now go to markets and sell some of the weaving. We've also started a knitting club, which also allows the mainstream community and the refugee community just to come and socialize, you know. And I think offering those opportunities for people to get together, and for the refugee community members to also participate and give back has been really, really wonderful. The biggest success is just in the mentorships and the tutoring programs that we have. All of our refugee staff members and our AmeriCorps members, they all have mentors and tutors. It takes many different, the support network that we might have growing up here, you know, just someone to lean on, someone to ask how you're doing is not there. So the fragility of anyone's self-sufficiency depends on the network of friends you have. So we have now several of our staff members getting their GED or going on to community college. We have some youth who we've matched with tutors for reading and writing. We have a mentorship program that now has 35 mentors. All our health navigators and our parent navigators are matched with mentors and tutors. We also have a family, so through the mentorship family sponsorship models too, we have some families who are high need families that are matched with another American family that really walks alongside with them.
We provide direct service, and direct service means day-to-day basic what the client needs. You know, they don't have money to pay for their rent because of their medical condition or because of they lost the job. So we show them, and since they don't speak the language, we go with them and show them the process. We are talking about parenting in American culture. We mainly focus on preschool and kindergarten. Burma is one of the most diverse country in the world because we have lots of language and dialect. Even I'm Chin, and then in Chin we have more than 52 dialects among just Chin. So whenever even I want to speak to my Chin, my same community, I have to use sometimes interpreter because I don't speak the language. I speak 7 languages. Even then, I still have to use sometimes interpreter because not everyone speaks Burmese. Burmese is our common language from Burma.
My role is as a family advocate and community-based ESL program coordinator. And I run community-based ESL 3 sites, and we offer 2 classes. And our classes are evening classes, Monday through Thursday. I have a 60 to 70 students every semester, and our students are really pre-literacy. I do with direct service and then short-term case management. I think the best part of my role at Embark is making sure the community are make sure they become self-sufficient someday.
For the refugee from Burma, navigating to this healthcare system is really overwhelming and challenging to the community. I even have one mom who told me that she lost her health insurance 2 years ago, and she didn't know why she lost that, and she didn't know what happened. So it is really overwhelming to the community, and especially this year when they have an MCO, Managed Care Organization. And the community who doesn't have the language, they don't have any idea what is MCO and why they have extra card that they need to carry around. I met her, you know, at the learning circle, and she's sharing after we talk about health insurance, how much is important in the United States. We end up helping her to apply Medicaid, which I think she will be qualifying.
there's a tremendous opportunity for refugees as new Americans, as new Iowans, to integrate here, and they have a lot of promise. We just need the larger Iowan community to come embrace them and support them at the level that they need to succeed.